Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Welcome back to the Health Upgrade Podcast. This is Dr. Habib with my co-host JP.
Great to see you.
And we have a wonderful guest today, Dr. Scott Sherr. Great to see you, Doctor.
It's good to be here with you guys. Thanks for having me.
This episode of the Health Upgrade Podcast is brought to you by Truvaga. Have you been looking for a simple way to feel calmer, think clearer, and sleep better? Imagine achieving this with just 2 minutes a day. I'm excited to introduce you to Truvaga, a handheld device that supports your nervous system through gentle vagus nerve stimulation. As a doctor specializing in functional health and wellness, I've seen firsthand how Truvaga has accelerated healing in my clients. I've used this device to help people with a range of issues, from sleep disturbances and heart palpitations to digestive dysfunction, nervous system imbalances, and mental wellness concerns. The results have honestly been remarkable. Truvaga is designed to catalyze and accelerate the shift in your body from fight or flight to rest, digest, and recover mode, helping you manage stress, maintain mental clarity, and unwind more easily. It's not just theory. I've witnessed its positive impact on real people facing real health challenges. The best part? Truvaga fits seamlessly into your routine. No need to carve out hours for wellness. Just 2 minutes a day can make a difference. It's a small investment of time for potentially significant benefits in how you feel and function each day. If you're curious to experience Truvaga for yourself, visit truvaga.com/upgrade. You can save $30 on your device by using the code UPGRADE30 at checkout. Remember, that's truvaga.com, truvaga.com/upgrade. It might just be the first step towards a calmer, clearer you, just as it has been for many of my clients. So Scott, tell me a little bit about your initial introduction and kind of into this healthcare space. Obviously, you're a medical doctor. Would love to know your journey in healthcare and how you kind of became interested in this really unique topic that we're going to dig into a little bit today about methylene blue.
So I'll try to give the short story here. It could be long. It could take up a whole podcast just to talk about my background. But in short, I'm the son of a chiropractor. So my father's a chiropractor on Long Island for 45 years. His name is Dr. Alan Sherr. And so I grew up very alternatively outside the box. And funny enough, he actually recommended that I go to medical school when I was really interested in science and medicine and anatomy, because he felt at the time the chiropractors didn't have as much wherewithal to do many things that he wanted to do. And so he's like, go to medical school, figure it out. And then you can figure it out from there, kind of thing. And so my journey really started, obviously, being very out of the box, going to medical school. I, of course, got tantalized by lots of different specialties where I could make a lot of money right out of the gate. But I ended up doing internal medicine because it was my fastest way out, actually. And my internal medicine residency was a 3-year residency after medical school. While I was in medical school, I got very interested in something called hyperbaric oxygen therapy, which is a very cool technology that I've been working with now for over a decade, more than a decade now. And I created an integrative practice after I finished my medical training using hyperbaric therapy as kind of the fulcrum, the main thing that I would work with. And then over the last decade, I created an integrative practice where I realized that you needed to do a lot more work to get people ready for hyperbaric therapy. And that often required significant emphasis on mitochondrial function overall. And so initially I was referring people over to functional medicine doctors. And then I kind of knew I wanted to do it myself in some way, but functional medicine felt really kind of this like big, black, huge box of things. And I didn't really feel comfortable. And then in 2017, I met a really interesting physician named Dr. Ted Achacoso, he's a physician based out of DC. He's also in Manila and in Paris. And he created a nonprofit called Health Optimization Medicine and Practice. And this is a nonprofit that's training practitioners on ways to optimize health rather than treat disease specifically. So focusing on optimizing rather than focusing on treating conditions and diseases. And even functional medicine's more focused on root cause illness than it is really on root cause of health. And so we are trying to create the first standard of care for health, not just disease. There's lots of standards of care for every disease you can imagine, as you both know, but there's no standard of care for health. And that's really what we're focused on, health optimization medicine and practice, or home hope for short. So it's a 7-module certification for practitioners, both licensed and non-licensed, that are seeing patients or clients in practice. And so that became the foundation of my practice, the foundation of my hyperbaric practice. And then it became its own thing as well. So I not only see people for hyperbaric therapy, but I also see them obviously for health optimization medicine. Now, this is where the transition comes, because when you're optimizing somebody's health, this takes a while. It's not like somebody's been going a certain way for 45 years that the next day or the next week they're going to feel better. They need things to help them along that way. So you guys have some of those tools, which are very important, which are the parasympathetic tools, right? We're very, very important. In our capacity, we were like, well, what can we find? What can we do right now to help our patients while they're on that longer path to optimizing their health, and kind of address some of the roadblocks, and one of the biggest ones being energy metabolism. And so that's how we came around to first starting our forays and being the first company actually to start having commercial products that have methylene blue in them. So that's the long and short of it.
I love it. And the fact that you kind of came to the realization through your hyperbaric practice that there was work that needed to be done prior to therapy. I think that's a really unique one. What are some stories or some cases that kind of come to mind as to people that maybe didn't take to HBOT as quickly as you were hoping?
Oh man, Navaz, my first effing patient. My first patient when I was a medical director of my facility in San Francisco at the time. So I was living in the Bay Area for many years. And this lady came in and she just really desperately wanted to feel better. And she wasn't at all ready to get into hyperbaric chamber. And what I mean by that is that she was just too sick. She hadn't really looked at worked with any providers outside of going to a couple of conventional doctors before coming to the hyperbaric facility. And she's like, I really want to feel better. I have fatigue. I have inflammation. I have, fill in the blank, these kinds of things. I'm like, sure, let's see if hyperbaric therapy helps you, right? And then when she went to the chamber, she felt so much worse. And, sometimes that can happen with hyperbaric therapy. Like sometimes when you're creating more oxygen in the system, like you can feel a little bit worse before you're a little bit better, but she kept feeling worse every day she went in. And then this wasn't just the only patient. She was my first patient, but she wasn't just the only patient that I noticed this is happening. If people were too sick, if they had significant amounts of inflammation, if they hadn't really addressed a lot of the energy metabolism issues, both the inputs and the outputs, meaning the machinery required to make energy, and also the machinery that's required to detox from the energy that we make, they didn't do well in the chamber over the long term. Sometimes they did okay in the short term. Sometimes they had some challenges in the beginning and then they felt better, but oftentimes they would go back to the way they felt before they started hyperbaric therapy. And so I realized pretty soon that you really needed an integrative approach, and that if there was an acute issue, if there's acute trauma, acute ischemia, acute infection, hyperbaric therapy could be fantastic in those capacities. But if they had a chronic issue, they had a long-term issue, they had a chronic infection, they had mild cognitive impairment or dementia, or they had chronic pain or chronic fill-in-the-blank autoimmune conditions, fibromyalgia, I can go and go. These patients did not do well if their first step or one of their first steps was hyperbaric therapy. And so a funny story is that I got disinvited from speaking at a hyperbaric conference because this is during the pandemic, and because the title of my talk was going to be, "Please do not put them in the chamber." and that's because I realized that we were doing a disservice for so many of these people that were coming in with chronic conditions and not looking at optimizing their health ahead of time. And so the first story is always my favorite to talk about, because I noticed this with several different types of populations of patients: fibromyalgia patients, Lyme patients, chronic pain patients, even concussion patients that had post-concussive syndrome. 6 months or a year later, I found that it was often better to wait 3 to 6 months to do hyperbaric therapy and work on optimizing their health, optimizing their vitamins, minerals, nutrients, cofactors, the antioxidant pathways, all these things. And so that's really where the integrative piece of my practice it became very evident early, and then it evolved over that time.
Sounds very much like there was this common path of chronic disease and something that was linking all of these conditions together as being kind of an underlying piece that was missing that needed to be addressed first, which is where functional medicine really thrives. And that is in mitochondrial health and optimizing mitochondrial function. I think that's kind of where JP was going there.
I was just going to say, what you need to do is rehab their mitochondria first. You need to get their mitochondria in a place where they can handle the higher flux of oxygen.
Exactly.
You don't do that, you're actually going to end up creating more reactive oxygen species, more free radicals, and they're actually going to end up with more inflammation and feeling worse.
Why don't we break down that science a little bit? when we're doing hyperbaric oxygen, what's the intent? What's the goal of hyperbaric oxygen therapy in treating different chronic conditions or different challenges?
I mean, so really what's happening in the chamber is three things. You are increasing the amount of oxygen in circulation by a significant amount. Not only are you saturating your red blood cells, which typically carry it, but also the plasma itself. That's the first thing. As a result of that, you can reverse low oxygen conditions, right? So this is, you have a stroke, you have a heart attack, you have a traumatic brain injury, you have a spinal cord injury, you have a limb that's kind of hanging off on the side. Like these are all things that hyperbaric therapy can help with because they can re-oxygenate tissue very, very quickly. The second thing that happens in a hyperbaric chamber is that you cause a massive amount of oxidative load, oxidative stress. This is reactive oxygen species because not only are you bringing all that oxygen in, what's going to happen? You're going to make energy with some of that. And with the energy that you're going to make oxidative stress. And also some of that oxygen is not going to go to making energy. It's going to go directly to reactive oxygen species and create an oxidative load. That is actually the main way hyperbaric therapy works. By creating that oxidative load, it creates epigenetic shifts. It creates shifts in epigenetic expression that change how your DNA is being regulated, right? So how these genes are being and proteins are being made. And the third thing that happens in the chamber is a pressure-related change where you have the pressure itself causing shear stress on the cells and on the vasculature that causes energy production. It causes lymphatic flow. It causes detoxification. So that's really the mainstay. And then as a result of that, you have things like decreasing inflammation. You have stem cell release. You have blood vascularization, the wound healing process being ramped up, immune system activation. The oxidative load is also great for infection. So people that have especially anaerobic infections do very well. So in essence, for me, the big thing that I realized is that it's the oxidative load that's doing the most heavy lifting, but it's also the oxidative load that's the most challenging for people that are already challenged on the cellular system, especially, of course, in our mitochondria. And you guys both know, I mean, 94% of the US population has some element of mitochondrial dysfunction. This is a lot to do with metabolic dysfunction, insulin resistance, medications, toxins, infections, post-infectious, all this kinds of stuff. And so as a result of that, we need to do something to really optimize mitochondrial function. And that's really where Methylene Blue is just a huge home run and super simple. And there are some nuances in dosing, and we can talk about the compound in detail, but it's been a game changer for my clinical practice is what it comes down to.
Let's talk about that for a minute. For those listeners out there who don't know what Methylene Blue is, let's start from the ground floor. And, what is Methylene Blue and what are its properties and what made people think that it was something that was appropriate for use in the way you're using it? Because there's other ways that it's been used. It's been around for 100 and some odd years.
Yeah. So it was the first drug that was registered with the US FDA in 1897. And it was actually a textile dye manufactured in the 1870s. And so if you were wearing blue jeans in the 1870s, they were likely dyed with methylene blue. So it actually is a type of dye called a thiazine dye. And so it was interesting that they were looking for something to help with malaria at the time. And for some reason, they were actually testing all of these textile dyes for their therapeutic properties. And they found that several, but especially methylene blue, had significant antimicrobial property. And in around that time frame, around 1897, it got the name of being a magic bullet. And the reason for that is that you could give very high doses of methylene blue and kill pathogens in the human system without harming the human host. And so that was kind of the thesis, as it were, that's why they called it a magic bullet, because it had that capacity. And so from the 1890s up until about 1950, methylene blue was one of the main antimicrobials available. There was no antimicrobials available until the 1950s, really, until penicillin came around. And so it was used very widespread at higher doses, around 2 to 3 milligrams per kilogram or higher, actually, for infections, for fungal infections, viral infections, bacterial infections, especially urinary tract infections, gram-negative bacteria. That was a very big group of organisms that was sensitive to methylene blue. Now we know there's in combination with near infrared light is actually even more powerful, which we can talk about in a little bit. But in essence, it was a fantastic antimicrobial. The World War II pilots that were in the Pacific Theater, near Japan and the Pacific in that area, they had to take methylene blue prophylactically, and they had all these songs about taking methylene blue because the side effect, which is benign, is that it concentrates in the urine. And so you would urinate blue. And at high doses, you actually get other secretions that turn blue as well, including your tears, including your poop, and things like that. So, including breast milk, actually. But I don't recommend any women breastfeed with methylene blue, but it does happen. So, in any respect, in the 1950s, after methylene blue was around for a while, all these antimicrobials that were now prescribed, your penicillins, the things came out. So it became less interesting because it had this side effect of turning things blue. From there, it became fish tank cleaner. So now we know that methylene blue is still, to this day, still used in fish tank cleaner. I don't recommend drinking fish tank cleaner ever, please. It's got a lot of impurities and heavy metals. And one of the main things with methylene blue actually is the quality you have to be careful of. It can be contaminated with heavy metals, with mercury, lead, arsenic, and cadmium specifically. So you don't want to be drinking or taking anything that doesn't have a certification and then comes with third-party testing and all those kinds of things. But anyway, from the 1950s, it became used in fish tank cleaner to clean the fish, not the tank. Actually, that's a misnomer. People think it's cleaning the tank. It's actually cleaning the fish. It treats their fungal infections and things like that. It also became a cellular stain. So many of us that were in professional school would have used it. And that's where it becomes interesting because where in the cell does it stain? But the mitochondria, actually. And we'll get there in a minute. But one thing I forgot is that it was also the first antipsychotics were derived from methylene blue in the 1950s as well, because methylene blue is a monoamine oxidase inhibitor, meaning it blocks the breakdown of norepinephrine, serotonin, and dopamine. And so you get a mood-enhancing capacity of methylene blue. It's a MAOI-A, I believe, inhibitor, if those people are interested. And so there's actually been studies in depression, in bipolar, and other mental health disorders using methylene blue. And we have a number of integrated providers now that are weaning their patients off of the SSRIs and SNRIs of the world using methylene blue. So, but to finish up the story, over the last several decades, there's been a lot more interest in how methylene blue works in the mitochondria itself, knowing that's where it stains in the in cellular culture if you're using it to stain cells. And it's still on the World Health Organization's list of essential medications, actually, because it treats a couple things that I hope nobody ever gets. One would be cyanide poisoning. And cyanide is a complex 4 destroyer, but methylene blue can actually compensate for that. And we can talk about how that works. And then there's also something called methemoglobinemia, which is a disease or a condition where you can't carry oxygen and you cannot deliver oxygen to your tissues on your red blood cells. This is because of the state of iron. And methylene blue is a redox cycler, and that's what's so cool about it. And so it can help recycle the iron state so you can deliver oxygen to tissue.
That's a lot. I want to step back to one of the early things that you talked about, which is when you treat a person with hyperbaric oxygen, there were 3 things that were really, the 3 key things. The second one was the one that I found most interesting because you said it was affecting the epigenetic controls of the cell. And you're talking basically about the fact that reactive oxygen species can disrupt the sort of original state of DNA methylation and histone modifications that are involved in controlling what proteins are produced and what proteins aren't produced. So I'm just wondering, that's typically epigenetic drift or changes to the epigenome are typically associated with aging. And so are you talking about a restoration of the epigenetics back to the way they're supposed to be, which is sort of the holy grail of partial reprogramming for anti-aging therapies? Or are you suggesting that it is having a shift in the epigenome in a sort of pro-aging perspective?
Anti-aging perspective, right? And so what I would say is that the answer is we have several studies in the hyperbaric literature showing that hyperbaric therapy can reverse signs of aging, things like senescent cells, for example, or improving telomere length. And so in essence, what I would say, JP, is that in a optimized human, hyperbaric oxygen therapy can have a reverse aging potential stimulus. And it does that. The oxidative load that happens with hyperbaric therapy, the oxygen sensitive genes that are stimulated as a result of the epigenetic shifts from the oxygen exposure are ones that are responsible for decreasing inflammation, for improving vascularization, and improving the capacity for cells to revitalize themselves and not be senescent overall. So, but this bears the question of what I was talking about earlier, is that if you already have somebody that has significant amounts of oxidative load in the system because of inflammation, because of infection, because of whatever, then it may not go the way you want it to go. And that's kind of really where having support is very, very important. Having a integrative approach is very important. That's why I use our health optimization medicine framework to optimize mitochondrial function and all these various pathways along the way. Because getting burned like I did in the beginning of being involved in hyperbaric medicine was because I was giving people too much oxidative load and their body just couldn't handle it. We would try to give them extra glutathione before they went in the chamber, or try to give them binders and detox them afterwards. But and I still do that sometimes. But the idea really is, can you optimize the system, knowing that if you can optimize it and you're giving extra oxygen, you are going to have reverse aging stimulus to the whole system at large.
Do things like MCT oils and things that will increase ketone levels and low sugar diet, I would imagine those are things that are
of course
really important for if you go in there with a lot of sugar in your bloodstream, it's probably going to take you beyond what is the load that you're looking for into that sort of danger zone.
And really what you're getting at is just the mitochondrial optimization aspect of things, right? And if you're not well optimized beforehand, you're not going to see the benefits that you would have otherwise. And that's really where health optimization medicine came in for me, where the framework that I use to optimize mitochondrial function. And then, of course, using methylene blue, because the great thing about methylene blue, JP, is that you can start using it at low doses in almost anybody, even in people that can't tolerate most mitochondrial support. I mean, we have a lot of people out there that are just so sensitive these days because of all the exposures, toxic exposure, insulin resistance, you name it. And of course, being parasympathetic is a very important part of this. But methylene blue, what it can do in the mitochondria, maybe we can talk about that now, is that it's what's called a redox cycler. And there's very few compounds that act in the same way, at least in one compound, which is very interesting. So what methylene blue does is it can donate electrons to the electron transport chain, but it also can pick up free electrons at the same time, like an antioxidant. And so most people with mitochondrial dysfunction have a combination of challenges, but oftentimes it's one of the complexes that aren't working or that isn't working very well. And so oftentimes that's complex 1, sometimes it's complex 2, sometimes 3 and 4, but often complex 1 is the main one that gets injured. And so what methylene blue can do is it can do a number of different things. But if any of the complexes are not working, it can bypass those complexes. It can recycle NAD and FAD back to the citric acid cycle so they can continue to pick up electrons from the food that you're eating. And donate electrons. So methylene blue can donate electrons to complex 3, to complex 4, even if complex 4 isn't working. So if you have cyanide poisoning, that's what happens actually. Cyanide destroys complex 4, but what methylene blue can do is it actually can recycle NAD and FAD, as well as donate electrons directly to complex 3. So you still have complex 1 and 3 maintaining their electron flow. So you're maintaining some gradient. And then you can actually have methylene blue donate electrons to oxygen directly, making hydrogen peroxide, which sounds bad, but hydrogen peroxide is a signaling molecule, which I think both of you know. And what hydrogen peroxide can do is actually go across the membrane, the inner membrane of the mitochondria, and pick up electrons and be electron sink from the electron flow going through complex 1, 2, and 3. So you can maintain electron flow. You can still make energy. So you don't have complex 4 working, but you have complex 1 and 3. And so you still get energy production, even if cyanide has destroyed your complex 4. So that'll buy you time, right? And so that's the beautiful thing about methylene blue, is that we can see this in patients like in real time as you are giving them methylene blue at these low doses. Sometimes it requires higher dose, but oftentimes it's lower dose with mitochondrial dysfunction. And you can see them like all of a sudden have these dramatic shifts very, very quickly as a result of that.
That's a really cool kind of overview. I love how, and I just want to bring it back because you mentioned that staining of tissues for analysis and a histological perspective, that the methylene blue stained the mitochondria. This is where we're now seeing on the physiological side where it's affecting the mitochondria really positively. And it's positively, it almost sounds, and I'll just kind of summarize it for the lay person here, that it's going in and cleaning up the complexes of mitochondrial function that enable energy production to occur in a very clean, passive way. And that way, it can help to support the mitochondrial reset. And done so over a period of time, what it does is it shifts the way that, or it increases mitochondrial resilience to all of the oxidative stressors that can be present when we're stuck in a glycolysis pattern. So for the listeners out there, remember that mitochondria can either use carbohydrates or fat to produce energy. When it's focused and it's stuck in a carbohydrate use manner, it's stuck in this glycolysis pattern. What it's doing is it's creating a lot more reactive oxygen species and oxidative stress. And when we're stuck in that state, what's happening is we're not allowing the body to become resilient and shift to using ketones effectively and using oxidative phosphorylation, which is the more efficient manner or the less side effect driven, the less damaging method by which mitochondria can produce energy. And so if we don't have that resilience where we can't go back and forth, where we're stuck in this glycolysis pattern, methylene blue can come in, clean up a lot of the residual breakdown and damage that's occurring in the mitochondria and shift towards that oxidative phosphorylation or allow for the opportunity for that to then occur. And then we can add in a lot of these positive lifestyle changes and recommendations to push the body into a state where it can then actually benefit from something like a hyperbaric oxygen therapy.
Let me riff off that for a second, because I think one of the things that you mentioned about what methylene blue can do as an antioxidant is really interesting, because when mitochondria are becoming dysfunctional, part of what's happening is they're generating lots of free radicals and reactive oxygen species. And that does occur more frequently when you're relying on sugar as the primary fuel. It's less so when you're dealing with fatty acids, but it happens in any way. And frankly, sometimes at some low level, those reactive oxygen species and free radicals are actually serving as signaling molecules within the cell. But at high enough levels, they begin to damage mitochondrial DNA as well as nuclear DNA. And when the mitochondrial DNA are damaged sufficiently or at a high enough level, the mitochondria sort of undergo their own version of apoptosis, which is cell suicide, or in this case, mitochondrial suicide. They eject their DNA, and that DNA now is floating around inside the cell, outside of an organelle, and that's a very potent trigger for inflammation. And when you get that inflammation, now the cell is losing its ability to function and generate energy through mitochondria. It's becoming inflamed because of its own triggers. It's losing the ability to actually go through apoptosis and commit suicide because it's becoming dysfunctional. It becomes sort of this zombie cell, as you were talking about senescence. But one of the things that occurs inside the cell when it's inflamed is you stop making the critical antioxidants that can stop this process and bring you back down from that inflammation level. And those are things like glutathione and melatonin and superoxide dismutase, all three of which are inhibited by inflammation. And so by introducing another antioxidant that can actually get into the mitochondria, because remember, there's lots of antioxidants like vitamin C and vitamin E and things like that, great things in the cell, but they can't get into the mitochondria. Okay, so, but if methylene blue can get into the mitochondria and serve as an antioxidant in that capacity, you can actually break the entire cycle of this inflammation. You can maintain the mitochondrial DNA and support the mitochondrial health, and that prevents the STING pathways being activated and less inflammation. So absolutely, I think of that as one of the most important things that it does.
Yeah, I love, Navaz, how you described as sort of like an energy, like a cleanup of the mitochondria. I think you have a very good turn of the phrase there. I think when it comes to the antioxidant capacity of methylene blue, that is related to both a direct ability for it to pick up free electrons or pick up those oxidative load itself. And then at the same time, at higher doses of methylene blue, it induces that hydrogen peroxide production. And when that happens, that stimulates what's called the NRF2 pathway in our cells, which increases our production of glutathione. So this bears the question, of course, is it possible for your cells to make glutathione, right? Are you already deficient in the machinery to be able to do this? So you have to be careful. And this is where the dosing of methylene blue is very, very important. Oftentimes you'll find, at least I find, that many people are taking too much methylene blue instead of realizing that lower doses overall are going to be probably better because they're not going to cause as much stress on the system, especially for people that are sicker, like the people we were talking about before. And this dosing has been interesting because most literature shows dosing around 1 milligram per kilogram or higher. But if you look at the literature for more neurologic conditions and even things like Alzheimer's, for example, the dosing is much lower than that overall to see some significant benefit. 8, 16, 25 milligrams. These are much lower doses. And the reason for that, I think, is that you're not causing a lot of stress on the system as opposed to these higher doses. And there was a good example of this. They did a study on Alzheimer's patients where they gave them, there were 3 doses of methylene blue that were given. There was 8 milligrams twice a daily. I think it was 75 milligrams and 150 milligrams twice daily of methylene blue. So pretty high doses overall at the higher level. And they found, so the 8 milligrams was the placebo group, the sham group. And the reason why they did that is they wanted everybody to have blue urine. And so that everybody didn't know what dose they were taking, kind of thing. But what happened here? The 8 milligrams twice daily did much better than the 150 milligrams and the 75 milligrams twice daily. And my sense is that the reason for this is that when you get to higher doses of methylene blue, what's going to happen is that it's going to compete with oxygen as the final electron acceptor at complex 4. And as a result of that, make more hydrogen peroxide. And that could be a good thing if you have an infection, if you have an acute trauma, like there could be good reasons to have these higher doses. And all of my patients have a higher dose methylene blue in their medicine cabinet in case that's needed. But at the same time, you're causing a significant amount of requirement of the cells to make more glutathione in this case. And if the cells can't do that, if they're already under significant amounts of stress, the body doesn't have, and it's already depleted in these kinds of things, then you're going to see a problem overall. And so at the lower doses, you just don't see that happening. The lower doses don't compete with oxygen in the same way, at least clinically. In fact, what's interesting is that at lower doses, if there's not enough oxygen around, so if you're an endurance athlete or if you're on an airplane and you're at low oxygen conditions, methylene blue can act just like oxygen actually and be the final electron acceptor in complex 4 of your mitochondria. And so this is what we're using in people, obviously, when they're flying a lot, also in endurance athletes and people that are doing lots of aerobic work because they can go longer when they have methylene blue around. And I have a good story. I worked with a friend. He's become a friend here now here in Colorado, who did something called the Leadville race, which I don't know if you guys have heard of the Leadville race, but it's a 100-mile race in Colorado. And it is the hardest ultra marathon in the world because there's 12 and 13,000 foot peaks. And he had a couple different issues the year before. He had a lot of diarrhea actually, and we had to work on that. And that was actually a glutamine issue. And that's a sort of a separate story. But we worked on that, but we also gave him 32 milligrams of methylene blue pure every 4 hours. And he shaved 3 hours off of his time from the year before. Now, some of that was because he wasn't shitting himself. Like he had diarrhea the year before. And so that was a big one. And so we worked on that. But I used that, and I used a methylene blue in combination with nicotine, caffeine, and CBD. It's one of the other products that we have at Transcriptions, which is the for-profit entity of the Home Hope company that we were talking about before. But anyway, so he used the blue cannatine along with, which is the combination of those things, along with the methylene blue, and did very, very well. So to JB, I think to kind of like sum up with Navaz too, because you guys did a great job. What methylene blue really does is a redox cycler. It helps provide energy to the mitochondria. It helps provide detox capacity, and it can compensate for energy problems in the mitochondria. It can help reboot the mitochondria in that capacity. And it also can buy you time while you're working on your vitamins, your minerals, your nutrients, your exposures, your sleep, your vagal tone, and everything else. And that's what's so beautiful about it, because oftentimes if you start giving people B vitamins too quickly, sometimes they just kind of go over the edge, right? Or if you start giving them antioxidants, right, all of a sudden they start getting detoxification symptoms and like, oh crap, I can't deal with this. And so like if you titrate methylene blue very, very slowly, like I start off at 4 milligrams and then I'll increase the dose every 3 to 5 days, about 4 milligrams until I start seeing a benefit. And when I find that benefit, it depends on what the benefit is, if it's what they're looking for or not. But in essence, you titrate the dose until you see the benefit. When people tell me that methylene blue doesn't work for them, it's usually because they haven't gone to a high enough dose yet. Some people need a higher dose than others. There are people that can't tolerate higher doses for various reasons. We can talk about that. But in general, if you have a chronic condition, you want to start off with a lower dose and titrate that dose over time. So you give the mitochondria time to get used to making more energy. Give that mitochondria time to start having more detoxification capacity. And you can combine it with other things. That have a lot of clinicians that are using it with things like LDN and taurine and other various types of compounds. And I use it a lot in combination with many things, including red light as well. And because there's synergistic potential there. So I'll stop. You guys have questions. Go ahead.
I have one, which is the effect on VO2 max. Has that been measured? Because obviously you're talking about, and is it listed as a performance enhancement? Because it sounds like almost like blood pumping. I mean, you're basically just increasing the oxygen carrying capacity of your blood and increasing your mitochondrial efficiency using an artificial substance.
So it's WADA approved. It's not on the banned list. You can use it. And we are testing it now. It hasn't been tested formally for VO2 max training, but I can tell you from internal and very high performance external training or external testing that it does increase VO2 max. And the most interesting way that it seems to actually be most effective is with hypoxic training first and then using methylene blue. And this makes sense, right? Because if you're hypoxic training, you're going to have more of a flood of oxygen to your cells as a result of the hypoxic stimulus. And it is giving you more energy capacity and energy efficiency in your mitochondria for longer as a result. So you are going to see that bump, at least anecdotally. We don't have any studies yet, but very excited for that piece. I've had a number of different conversations with cycling teams and others that are starting to think about using it. The main issue people have, and I think both of you know this, is that it's blue. It's just very, very blue. And there's some challenges with that, but I think they're very surmountable, I guess. They're not insurmountable.
Yeah, I haven't seen too many MLB players or basketball players with blue tongues. So
they're
see
doing
that
it,
they're
though.
not. They are doing it, I'm sure.
Yeah.
And that's really cool because we're ultimately looking at improvements in health, but ultimately performance enhancement to some extent, right? Where mitochondria are more efficient, mitochondria are working more effectively. And when it does work more effectively, then it can utilize carbs and fats very effectively. And we have this flexibility that we're kind of looking for. And that enables healing to truly occur because the mitochondria that mitochondria, as we know, are in every single cell of the body, but particularly that
except
in the
for
immune system, except for the red blood cell. Yes.
There you go.
So when it comes to this important thing that we're looking at is the immune system cells, right? Macrophages are very, very important when it comes to the mitochondria function within them. There's this really unique term right now called immunometabolism, how the immune cells are metabolizing and creating energy and how they're then working to support the health of every single tissue that they are in.
Mm-hmm.
And when it comes to this immunometabolism piece, if we're stuck in that glycolysis state where we're just using carbohydrates and we're producing free radicals like crazy, we're actually causing the immune system to be in a state of threat response all the time. And that's pushing us in this sympathetic state and it's causing damage to the organs. And that's what's leading to chronic disease. If we can shift these immune cells to be in that glycolysis or into that oxidative phosphorylation state to be more efficient and to actually be able to clean up the situation more effectively, then ultimately it's the immune system that creates that recovery process within each of those different organs. So this is why you're seeing things in Alzheimer's. This is why you can see things happening, I imagine, with detoxification processes in the liver and in the gut, and you're seeing improvements all throughout. Are there interesting cases that you can kind of point to with changes, not just in performance, but in actual chronic health conditions?
Yeah, I mean, we were kind of alluding to this. So where there's only one cell that's human in our system that does not have mitochondria, where we have our most mitochondria per cell is in our ovaries, testicles, so sperm, and also brain, heart, liver, musculoskeletal tissue, and our immune system, obviously, as well, as a big piece of this. And so what we've seen over the last several years using these products with patients is that you see the most bang for your buck in those locations where there's the most mitochondria per cell. So even though it's not well described in the literature, fertility rates go up. And we've seen this as being now used in an integrative way in some fertility clinics where they're using methylene blue as another way to mitochondrial optimize, along with obviously diet, lifestyle, using a lot of peptides now in this world as well. From a cognitive perspective, I've seen just transformative things and people with severe brain fog, concentration issues, fatigue. And this is, I mean, I can think of a patient that I was just speaking to a couple of weeks ago, actually. Actually, she's a practitioner. She was a physical therapist, and she's one of the practitioners that works with us at Transcriptions. And she has her own clinic, but she'd been out of work for 2 years because she had really bad mold exposure. And she had cleaned up the mold. The mold was gone, but she still felt terrible. And she started taking methylene blue, low doses, 4, 8 milligrams. and her pain and her discomfort and her brain fog went away in several days. And she was back to work like in a couple weeks. And so in the beginning, we saw a lot of these sort of last ditch effort kinds of things, right? Where people had tried everything. They'd been sick for years. And then all of a sudden they finally tried methylene blue and their symptoms recovered. I had another lady with really bad ankylosing spondylitis, somebody that had really bad pain in her back. And this all developed actually around COVID. And there was a question as whether there was a piece of this. And she started taking methylene blue. She tried everything and her pain just disappeared. And we've seen a lot of people, like a good story we had in the beginning of our experience was a nice young biohacker. She gave it to her grandmother, who was around 85 years old, had grown up in Mexico and had some cognitive impairment. And she gave her some methylene blue. And then 30 minutes, an hour later, she started talking about these stories of being a child in Mexico during like the Mexican-American War and things like that. So it was a very, very cool ability for her to regain some of her memory over there. And we've seen some significant improvements in cardiac function as well over the years. And this is, again, related to how many mitochondria per cell we have in our hearts, of course. And then a lot of people like with exercise-induced fatigue, I can think of one particular individual that was having a really hard time, just couldn't go more than a couple blocks around the neighborhood. And then if she did this, she wouldn't be able to move for about 3 to 4 days afterwards. And this is a real sign of mitochondrial stress, as I think you both know. And so she started taking some low-dose methylene blue. She started pairing it with the sunlight. And in the sunlight, we have near-infrared light. This is about 680 nanometers that has been studied as a really great combination with methylene blue, because what will happen is that the near-infrared donates photon electrons directly to complex 4 in our mitochondria. And so methylene blue can also donate electrons directly there, also compensate for the mitochondrial dysfunction in other locations, as I was talking about. And as a result of that, she just was starting to walk 3 blocks, 4 blocks, a mile, 2 miles. Like within a couple months, she was doing 5 miles around the neighborhood, right? So and this is a pretty impressive combination and recovery. And we've seen this across the board in so many different types of individuals, because mitochondria are everywhere except for that one particular cell. And so as a result, you'll see people start getting more energy. They start feeling like they have less pain. They're, overall, and a big part of this, where there's a little bit of controversy, Navaz, which may be interesting to kind of dig into, is in the nitric oxide world, because there is some controversy where nitric oxide is always thought to be a good thing, and it is in our cells on some level, but it also can be a very bad thing as well. And this is what we call circulating nitric oxide. This is what's in our blood vascular system. That's a nitric oxide that can cause inflammation, that causes low blood pressures, that can cause a host of other symptoms as a result. It causes pain as well. And so what methylene blue can do is actually it can neutralize circulating nitric oxide by preventing circulating nitric oxide synthase from converting arginine into nitric oxide.
That's the inducible form, the INOS specifically, which are triggered primarily in macrophages in the white blood cells.
But nitric oxide also tends to make your cytochrome C oxidase sluggish, sort of binds to certain motifs on the enzyme. And that's why red light therapy works. Red light therapy actually dislodges that nitric oxide from that enzyme, the cytochrome C oxidase. And that's really important for mitochondria. So if methylene blue is having an ability to, almost like red light therapy, dislodge that nitric oxide, that would be another way in which it could be beneficial. But I wanted to ask a question about calcium levels. Does methylene blue affect calcium levels in mitochondria? And as sort of a second question after that would be, does it induce biogenesis? Do you get more mitochondria? Does it trigger sort of an increase in that? So is it helpful for turning, white fat into beige fat? Or, within muscle, do you actually see biogenesis?
So when it comes to calcium, I don't know about any particular research here that shows that methylene blue will increase calcium influx or outflux or whatever it might be. There is some question regarding copper specifically and copper binding to complex 4. And if methylene blue, because of the colors specifically, has some sort of, because I know there's all these sort of, the electron doesn't go, as you guys know, it doesn't just go through each complex like once. It goes through like all these little steps along the way, like inside of each of the complexes, including complex 4. And there's stereoplasm in there, there's copper, like there's a whole bunch of things. And we think that there's something to do with the pigment itself of methylene blue that's causing some sort of efficiency aspect of complex 4 related to copper. But but calcium I'm not sure of, to be honest. On one step back, though, when it came to nitric oxide and how methylene blue works, the inducible piece, it definitely has a neutralizing effect. And we've actually seen this in people like with POTS, for example, so positional hypotension and tachycardia syndromes. These patients do very well, oftentimes with very low doses of methylene blue that just bind the inducible nitric oxide synthase or prevent it from converting over to the nitric oxide. In the mitochondria, what we think is happening, and this will go along with the mitochondrial biogenesis piece in a second, JP, is that when you are revving up metabolism using methylene blue, basically you're donating more electrons, you're making more energy. What you're doing is creating a stimulus that says, hey, to the surrounding, the cells are saying, I have more energy that I'm making. I need more substrate to be able to make it. And so there's some indications that as a result of that, it increases the amount of nitric oxide that is released from the mitochondria. So maybe it's unbinding, I'm not sure, from complex 4 to help stimulate the vascular dilation around those cells so that more substrate, so if it's more sugar or if it's more ketones or whatever's around, to help make more energy. And in the same way, this is what we think is a stimulus to help you make more mitochondria at the same time as you are also creating more capacity to increase substrate or increase the building blocks of making energy to the cell. So there is some evidence that mitochondrial biogenesis is happening. There's also some evidence that senescence is also being reversed using methylene blue as well. And I think that might be slightly a different mechanism. That's probably with more mitochondrial efficiency and cleanup that we were talking about before. I'm not sure about nitric oxide being involved, but that's in essence where we think that methylene blue might be helpful. But again, I think that a main issue here is just the dosing. I think that if you're giving low doses for long periods of time, you can certainly do that. And it can be very helpful to the mitochondria. It can do everything that we're talking about. But if you're giving high doses for long periods of time, especially over 1 milligram per kilogram, especially 2 milligrams per kilogram or higher, then there may be a short-term benefit to that. And there have been some studies actually that have shown that. There was even a study showing increased cognitive visual spatial recognition and cognitive capacity memory with just one dose of about 100 milligrams of methylene blue, which is about 1.5 milligrams per kilogram for most people. That's great, but my sense is that you gave that over long periods of time, you would not see that potential benefit play out over the long period of time because you'd have potentially more oxidative stress that's happening related to higher doses of methylene blue. And so I think that there's a sweet spot. I think for most people, it's going to be lower than that as a dosing.
Makes a lot of sense. I like the idea of this microdose being kind of that point where you begin and then slowly titrating up. Is there any situation where you don't want to utilize methylene blue, where you want to be really careful to not start? I just want to make sure anybody who's thinking about it is certain that they could potentially do it.
Yeah, it's a good question. So we have a couple of reasons. So if you're pregnant or breastfeeding, you shouldn't take methylene blue. There's some studies, at least in the 3rd trimester of pregnancy, that methylene blue can be dangerous. These are in people that were getting, what are they called? Amniocentesis and things. So it's not very common. But again, in those populations, also, if you have high blood pressure and you are on a number of blood pressure medications with a difficult to control blood pressure, because methylene blue has a monoamine oxidase inhibition, it increases norepinephrine. And so that can increase people's blood pressure. It doesn't usually do it a huge amount if you already have normal blood pressure, but if you already have high blood pressure and you're hard to control, it can increase that. So not that you wouldn't use that. If you're a clinician, then I still use it in practice. I just go very slowly with the dosing and I just check people's blood pressures or really have them check their own blood pressures to see if there is a significant rise. Oftentimes it's not a huge issue really, but it's something to be aware of. The other major thing is that you want to be considerate of some of the other medications they might be on. So if patients are on SNRIs, which block serotonin reuptake, or dopaminergic drugs like Parkinson's drugs, which again, methylene blue increases serotonin, dopamine, and norepinephrine. So you want to be thinking about just being aware of the dosing. If you are a clinician, you can absolutely use methylene blue in these patients. You just have to go very slow with the dosing and just watch them carefully. If you are not a clinician and listening, I don't recommend using methylene blue unless you're working with a clinician in those capacities. But as I was alluding to earlier, I have a number of integrative psychiatrists that I work with that are titrating their patients off of their their antidepressants and then antipsychotics even, using methylene blue as a compensatory compound with more of a mitochondrial optimization, because a lot of these mental health conditions have a significant amount of mitochondrial dysfunction, as you guys very well know, in addition. So
that's awesome. JP, I think you had an experience with methylene blue and red light therapy being utilized in conjunction with one another. Did you want to talk a little bit about that?
Yeah, I was briefly working with a company based in Canada that is using methylene blue as for its photosensitizer
Yep.
capacity.
Mm-hmm.
And they were focused primarily, and they still are focused primarily on the antimicrobial benefits, because when you expose methylene blue to a very intense red light, I think it's 640 nanometers, it undergoes quantum effect reaction that results in lots and lots of free radicals. And
It's hydrogen peroxide, actually.
it's
Yeah. Yeah.
creating
Yeah.
hydrogen peroxide.
Yeah.
The interesting thing, and they actually patented it, is that they found that it worked with non-professional antigen presenting cells in the endothelial lining of the nose to actually enhance the adaptive immune system's response, to sort of enhance tolerance and prevent sort of the consequences of leaky gut, if you would. It sort of made your immune system more alert to what it should be tolerant to and what it shouldn't be. Which
Interesting.
helped
Okay.
to maintain. And frankly, the idea is that your macrophages utilize reactive oxygen species and hydrogen peroxide as the primary mechanism by which they actually kill things. And so when you destroy a bacteria or a virus or a fungus or otherwise in this manner with methylene blue and the red light, it leads to sort of the right types of fragments that get picked up by antigen presenting cells. And so this is activating the immune system. The other thing which I found fascinating, and maybe you can help me understand why this is the case, why methylene blue is such a good stainer of cancer cells, preferentially, because it's used in treating cancer, because you inject the methylene blue or even just with a wash in the mouth, you can see cancerous lesions in the mouth. And then with red light therapy, you can expose the cancer cells to this very high flood of reactive oxygen species that kills off the cancer cells. It's pretty remarkable therapy. I mean, my wife has actually used it for her own treatments for some, precancerous basal cell type things. So help us understand how that works to the extent that you're familiar with it.
Yeah. So a very interesting combination, what you're describing with especially the nasal application overall. Not only are we making hydrogen peroxide, but we're actually making hydroxyl radicals, which are the OH. And like those are even more oxidative than hydrogen peroxide. Hydrogen peroxide is even more stable than that. So the combination of high frequency near infrared light, somewhere between 640, but 680 is what I've heard mostly, along with methylene blue as a photosensitizer here, can be very, very effective. In fact, it was being used during COVID as well. I was using this in clinics. I wasn't telling anybody about it. I had friends that were using it in clinics along with hyperbaric oxygen therapy as well, because a lot of people had hypoxic stress, right? So you can use the extra amount of oxygen to help reverse or at least mitigate in a lot of ways. When it comes to breast cancer, or really, so the main studies that have looked at methylene blue in cancer have been breast cancer. And it has been with the photosensitization aspect of using methylene blue along with the near infrared light in local form. And so as far as why methylene blue would concentrate more in cancer cells than it does in regular cells, I have to think that it has to do with the aspects of metabolic activity. In general, where methylene blue is going to go is where you have more metabolic activity. If there's more, what these cells know, we know, like from like FGD PET and things like that, we know they suck up a lot of glucose, right? Because they're highly metabolic, and that's why you can see them on PET scans and things like that. So it would make sense to me that you would have more methylene blue in these tissues, because they have more need in the sense of to help them make more energy, because they have more substrate there and trying to make more energy on a regular basis. I haven't seen a lot of studies there as far as looking at methylene blue as a tracer or as a metabolic activity enhancer specifically in cancer, but I'm going to have to take a look at that more, JP, and see, because I can see why that would be. Look, I'd rather have somebody do like an FDG or FMB study on me. I do worry in some patients where you're doing PET scans on people, you're giving them a glucose tracer. Like, I don't want to do that in some of my cancer patients. Like, I would rather know if they have cancer, but not have to give them glucose to be able to do that, right? So maybe you guys have started a new business right here. I don't know. Looking at methylene blue radiology. I don't know. It sounds interesting to me, actually.
There are companies that are doing this.
Oh, nice. That's awesome. I need to look into it. This is super cool. Okay.
And esophageal cancer and mouth cancers are also, along with breast cancer, interesting. But the
yeah, cool. There's a cool thing about mouth cancer, just as a side note, like dentists, what they used to do back 30, 40 years ago was paint the mouth with methylene blue, like the whole mouth cavity, and then look for areas that looked abnormal. And then those would potentially be like aplastic or like some sort of, abnormal tissue, and biopsy those areas. So I know methylene blue has been around for that reason for many years in the dental world.
Yeah. And what they're doing now is they're just, after they paint the mouth blue and they see where it's being absorbed,
now they're
they just load it up with red light and causes the cancer cells to be flooded with the, as you said, the free radicals, reactive oxygen species. Yeah. The interesting thing is how it's working with the immune system. But, cancer cells are also, the Warburg effect. Their mitochondria are dysfunctional.
Right.
Cancer really is we had Thomas Seyfried on
sure. Yeah, I know Tom. Yeah.
About 10 episodes ago, talking about the importance of mitochondria in cancer. So it's interesting that something that's designed to sort of help mitochondria function better is staining cells that have mitochondrial dysfunction. It's sort of an interesting.
Yeah.
I'm trying to get to the bottom of why.
Yeah, I'm not really sure either, to be honest. I'm going to have to look at it a little bit more and see. I don't know. Again, my sense of it is that it's a metabolic activity thing more than anything else, but I don't know enough to tell exactly why that it would be preferential. Because I was trying to, as you were talking about, I'm like, well, they're dysfunctional. So is methylene blue trying to come in there and improve their function, or is it just because it's a metabolic activity thing? So I don't know. I'd have to look into that a little more. It's interesting. Yeah.
I think we were all having that same thought, and we're all in like deep gears turning thought right now as to
is it trying to reverse them and make them non-cancerous? That's the other thing I was thinking about. Is it their capacity to let these cells remember that that you're not a rogue cell, you're part of the system, man. Get back in order. I don't know. It's interesting. So
amazing how fast these people heal though, and without very much scarring after this treatment. So you could be right. It could be rehabilitating these cells, which would be interesting.
And that's my sense with senescent cells, at least, is that there's a rehabilitation capacity, and not.
It's not a senolytic; it's a xenomorphic.
I haven't heard that term, but I like that, xenomorphic. But I that's what I think is happening also in hyperbaric therapy. I think that, just to kind of go back there, I think what hyperbaric therapy is rebooting these things at the same time as I think methylene blue is doing the same thing. But I don't know if they're getting killed off. That's okay too. I don't know. But either way, there is some effect there as well.
This is a really cool conversation. I'm really the gears are absolutely turning, and I'm really thinking that if there's got to be a metabolic effect here in terms of being able to enhance kind of a fasting or a ketogenic type of approach to push in that direction. Have you noticed anything in that perspective?
With our thyroid patients, people that have thyroid issues, like your Hashimoto's patients, your hypothyroid patients, they tend to need less medication. And we actually have seen some antibodies go down as well for the Hashimoto's presentation. So I think that you do see, I've seen this across the board, an improvement in metabolic activity overall. We haven't really been kind of tracking weight per se, but I have had people that are using it while they're losing a whole bunch of weight because they're taking Ozempic or whatever it might be. And they tend to do better when they're on methylene blue because it's helping with the energy and detox side of things. When you're shoving a whole bunch of fat into circulation and all the hormones and inflammation that's associated with the fat that's hanging out there. So,
well, as the fat goes into circulation and you want to utilize the fats more effectively and activate ketogenic activity and more oxidative phosphorylation in those mitochondria, cleaning up the crap that's kind of gone on with excessive glycolysis time probably is a supportive tool. So I'm really liking this on the metabolic side of things too. That's really, really wonderful. Dr. Scott, this has been such an awesome conversation. I want to ask a little bit tell us about transcriptions, tell us about where people can learn more about utilizing some of these methylene blue tools that you guys have.
Yeah, so Transcriptions was the company we developed outside of, or as a result of understanding that we needed to help people right now while they're on the longer path of optimizing their health. And the nonprofit Health Optimization Medicine and Practice is kind of where we started. And so Transcriptions developed a number of different products. We have a number of different products on the market now. We have two different strengths of methylene blue, pure methylene blue, one called Just Blue, one called Tro Plus Blue, and that's 50 milligrams per troche versus the 16 milligrams in the Just Blue. And as mentioned, the Just Blue is really great for mitochondrial optimization overall. Some people will need higher doses, and the Tro Plus Blue is available. As I did mention earlier too, I have all my patients keep the higher doses in their medicine cabinet in case they have an infection coming on, in case they have an inflammation or trauma, or even a stroke or a heart attack. Even though it hasn't been studied in humans for that, in animals, it saves brain and it saves heart and things like that. So it's there for everybody, for my patients at least. And so we have those two products. The Tro Plus Blue is only available to practitioners. So if you're a practitioner, you can sign up for an account at troscriptions.com and you can get access to wholesale discounts, practitioner portal, interviews, webinars, clinical resources, and those kinds of things. So I highly recommend that. We have drop shipping capacity. We have the ability for you to sell in your office if that's what you'd like to do as well. We also have another product called Blue Cannatine, which is a combination with nicotine, caffeine, and CBD. Nicotine's fantastic, and it's an anti-inflammatory. It's a cognitive enhancer. As long as you don't smoke it, vape it, use it with cigarettes and tobacco-containing products, you're good to go. And keeping the dose low, it's really fantastic. And this particular product's great for focus, for productivity. It's a good energy boost before exercise. It can be a replacement for things like ADHD drugs under the supervision of a clinician, and it's just fantastic. So those are our methylene blue containing products. And then we have a whole bunch of others that are in the GABAergic space, which you guys are very familiar with, that particular neurotransmitter: relaxation, stress reduction, parasympathetic activation, something called TroCalm for relaxation, anxiety reduction, something called TroZ for sleep. Using a cool pairing of GABAergic things that bind to the GABA receptor in cool ways that nobody else has done before. And then we have something else called Tromune, which is it was a little bit separate. It's based on a compound called cordycepin from the cordyceps mushroom, and it increases deep sleep. It increases immune system activation. In fact, it kind of goes along with that. It blocks NF-kappa B and mTOR pathways and upregulates AMPK. And it's also an antiviral, potentially anti-cancer. And so we use it a lot at night because it increases deep sleep, and it's fantastic. So that's the suite of products that we have.
And those products are available to everyone, or are those only to clinicians?
So all of them are available except for our Tro Plus Blue, which is our higher strength methylene blue, along with a Tro Plus Mune, which is a higher strength Tromune or cordycepin extract overall. So we have a lot of information on our website, troscriptions.com, lots of blogs. If you're a practitioner, like I said, you can sign up for a practitioner account. It's free, and you get access to all of the clinical information. We're on Instagram, of course, at Troscriptions. We have our nonprofit, Health Optimization Medicine and Practice. You can go to homehope.org if you're a clinician, you're interested in training. Outside of just looking at functional medicine, this might be a different avenue, was for me, looking at root causes of health rather than just looking at the root causes of disease. Not that you don't want to look at both, but optimizing health, I think, is a primary thing for everybody. And I think those are the main places. And then, of course, I'm at Dr. Scott Sherr, DrScottSherr on Instagram. And, you can find me other places too, but that's an easy place to find me.
I love it. I remember the first time I met you was at Integrative Healthcare Symposium in New York, just over a year ago. And you spoke right before I was going on stage, and your room was packed and I couldn't get in. And I was sitting outside fixing up my slides, and I snuck in at the last little bit, and I was like, what is this methylene blue stuff? And I've just gone down the rabbit hole this past year. So it's been really wonderful. Thank you so much for joining us and for sharing your wonderful knowledge and teaching our audience how they can boost mitochondrial function and get kind of these foundations of optimal health off the ground so that they can live an upgraded life, really, is what we're trying to do. We want to upgrade people's health. And so this has been really wonderful and very insightful. JP, any final thoughts from you?
No, it's great to meet you. And, if you've gotten this far in the podcast, we always say, if there's somebody out there that you think that is a friend of yours, a family member who could benefit from this, please share it with them and give them the opportunity to upgrade their health as well.
I love it. And we're going to call it there. Thank you so much for listening, and we'll catch you all on the next one.